Let's Talk ED and Your Eyeballs Erectile Dysfunction, ED, isn't just about what happens, or doesn't, in the bedroom. It can be your body's way of waving a red flag about deeper health issues like heart disease or diabetes. And while the drugs for ED, like sildenafil, a.k.a. Viagra, tadalafil, a.k.a. Cialis, and vardenafil, a.k.a. Levitra, can be miracle workers, they don't come without quirks. One quirky thing, they might mess with your eyesight. Yes, the same pills that help with blood flow down there can also affect the blood flow up here, your eyes. What's really going on? ED drugs work by opening the floodgates for blood flow, targeting an enzyme called PDE5. That's great for your downstairs situation, but it turns out there's a close cousin enzyme in your eyes, PDE6. When these drugs crash the PDE6 party, they can cause things like seeing everything with a blue tint or suddenly becoming hypersensitive to light. Creepy? A little. Fixable? Usually. For diabetic folks, the stakes are higher. Diabetes already puts your eyes on the VIP list for trouble. Hello, diabetic retinopathy. And throwing ED meds into the mix is like inviting a tornado to a windy picnic. Some studies suggest tadalafil might actually help improve retinal blood flow. Yay! But it's a tightrope walk because those same meds can trigger or worsen visual issues. Not yay. Pop a pill. See a rainbow. Some people notice changes in color vision after taking these meds. A blue-green mix-up might sound harmless, but if you're driving, designing, or just trying to match your socks, it's a bit of a headache. This isn't super common, but it's worth noting. And if you're seeing halos, blurred vision, or lights looking extra dramatic, it's time to call your doctor, not a ghostbuster. The science of sight and ED drugs. Here's the nitty-gritty. Your eyes rely on a delicate balance of blood flow and enzymes to keep your vision sharp. ED drugs mess with that balance by relaxing blood vessels all over your body, including in your eyes. That might lead to increased pressure or changes in how your retina processes light. Some patients report temporary effects like light sensitivity or a bluish tint to their vision. It's like your eyes are wearing Instagram filters you didn't ask for. But there's a silver lining. Most side effects are short-lived. As your body metabolizes the drug, your vision typically goes back to normal. However, if these effects linger or worsen, it's a sign to check in with your healthcare provider. Diabetes plus ED drugs. Watch your eyes. Diabetics are already on the struggle bus with eye issues. Add ED meds and you've got a whole new layer of complexity. Tadalafil, for instance, might help keep the blood flowing nicely in your retina, kind of like a retinal spa day. But for others, it could be the opposite, ramping up complications like blurry vision or light sensitivity. The message here? If you've got diabetes, your eyes deserve VIP treatment when you're discussing ED drugs with your doctor. Not all ED meds are created equal. Let's compare. Sildenafil is the OG of ED drugs, but it's also the one most often linked to temporary visual side effects. Tadalafil hangs around in your system longer, but seems to be gentler on your eyes. Vardenafil is somewhere in between. The takeaway? If you're prone to eye issues or already have something like glaucoma, your doctor can help you choose the safest option. Why your doctor needs to know, think of your doctor as the middleman in this love triangle between you, your eyes, and ED meds. Before you start popping pills, it's critical to share your full health history, especially if you've got any eye conditions like glaucoma or macular degeneration. Even your family's eye health history could provide important clues about how these meds might affect you. Doctors also keep tabs on dosage. Higher doses of ED meds might amp up the risk of side effects, so sticking to the prescribed amount is key. Self-medicating or doubling up isn't just risky. It could land you in a sticky situation, and not the good kind. Real stories, real lessons. There are reports of men who've noticed their vision go haywire after popping an ED pill. One man, a diabetic, found himself seeing the world in muted colors. Another had halos and blurry vision after 2 weeks on tadalafil. These experiences highlight why it's critical to monitor your vision and speak up about changes. Eye health is just as important as bedroom confidence, so don't ignore what your body's trying to tell you. How to protect your vision while treating ED stick to your prescription. Only take what your doctor recommends and never mix medications unless advised. ED meds plus certain other drugs, like nitrates, can spell disaster for both your vision and your heart. Get regular eye exams. Keep your ophthalmologist in the loop. If you're taking ED meds regularly, make sure to schedule annual eye checkups, or more frequently if you have underlying eye conditions. Monitor symptoms. If you notice changes in your vision, like blurriness, halos, or trouble distinguishing colors, don't brush it off. Early detection can prevent bigger issues down the road. Ask about alternatives. Not all ED meds are equal in how they affect your eyes. If you experience side effects, ask your doctor about switching to a different medication. The research frontier. What's next? Scientists are digging deeper into the link between ED drugs and eye health. Some studies suggest that the effects on color vision could be due to how these drugs interact with photoreceptor cells in the retina. Others are investigating whether long-term use might contribute to retinal disorders in at-risk populations. While the current evidence is reassuring for most users, ongoing research aims to ensure these meds remain safe for everyone. The bottom line, ED drugs can be a game changer for your sex life, but they're not free of side effects. Your eyes might bear the brunt, especially if you're diabetic or already dealing with vision issues. Always chat with your doctor about risks, get regular eye checkups, and pay attention to any changes in how you see the world. Because what's the point of looking good in the bedroom if you can't see it?